Good evening and welcome. I'm Kevin Edwards of Allied Physicians Group. Thank you for joining our follow-up COVID-19 Q&A webinar. Our hope is to provide you with valuable answers to many of the questions you are facing during this pandemic. Tonight's topics will include quarantine and social distancing, children and adolescents' mental health needs, general illness, allergies and asthma concerns, immunity, well visits and vaccines, and how we anticipate moving forward. Our speakers this evening come from some of the largest pediatric groups across our country. They are Dr. Kerry Fierstein, pediatrician at Allied Physicians Group in New York, Dr. Susan Sirota and Dr. Josh Levin, pediatricians at PediaTrust in Chicago, Dr. Ralph Strauss and Dr. Robyn Kreiner, allergists at Allied Physicians Group in New York, Dr. Patrick Hynes, pediatrician at Pediatrics in Louisville, and Dr. Shauna Freedman, child psychologist at PediaTrust in Chicago. Before we kick it over to the panel, a few housekeeping details. If you have additional questions, please use the Q&A feature located at the bottom of the screen, and we'll address them as many as we can once we're complete the webinar. Following the webinar, we'll also send out a link to this presentation as well as share some useful information. Keep on the lookout. We will be having more webinars in the future. One will be scheduled in about 2 weeks, and it should be on an exciting topic that will pique everybody's interest. So stay tuned for that. You'll see an email. With that, we thank you again for joining us. I'd like to introduce Dr. Kerry Fierstein from Allied Physicians Group, who will be leading our discussion this evening.
Kevin, can everybody see all of us now, or how are we going to do this?
We're going to get there right now.
Okay, while he's doing that, I want to thank Kevin and everyone at Adjuvant.Health for setting this up. I want to thank my fellow panelists, and mostly I want to thank everybody in the audience for sending in questions, which helped us figure out how we want to make this happen. You sent them in registration, you sent them in emails, you just kept sending them in. So there's lots and lots of interest, and we hope we're going to get to the most important questions tonight. So our first section is going to be on isolation, social distancing, and quarantine. So I'm going to warn you that a lot of the answers to this section are not absolute. And I want to give everybody an opportunity to understand how physicians think about this. We're used to looking at the world from risk and benefit. Every time we prescribe an antibiotic or decide to do a chest x-ray, we have to decide what are the risks of doing it and not doing it, and what are the benefits of the treatment. So that's really how we approach all of these questions today. We're used to it, but you guys are really used to it also. Before COVID, every time you got into the car, you took the risk of getting into a car accident, which is the greatest injury rate for children, versus the benefit of going wherever it is that you wanted to go, and the benefit of actually getting out of the house, which you really know what that is right now. So the first two questions I got, one is it safe for kids to play in our own backyard? I would say that's a yes. The outdoor air dilutes everything. It's safe to be outside within your own family. You don't have to social distance. It's okay. They can touch a tree. They can ride their bike. They can do all those things. The other question is, can my children go back to daycare? They have wipes and gloves and are taking all the precautions. So that's a very different risk-benefit analysis, right? The risk there is much greater. I don't care how many wipes you have in a daycare. If you have a 2-year-old who comes in that's coughing, they're going to cough on your child, on a surface, on the caregiver. There's just really no way around that. So that's the risk. The benefit is, well, why do I need my child in daycare? Do I really have to, go to work? Is there a reason that I need to take care of somebody else? Is there something else going on in my house, in my life, that I'm willing to take that risk? And then also, what's my risk at home? Am I taking care of my elderly grandmother who's living in my house? That may not be a risk that I want to take. But it's just me and my husband, and we really need to go to work, and kids don't get that sick anyway, then that may be a risk that you are willing to take. That's not a decision that any of us on this panel can make for you tonight. But we're going to give you some facts so you can help make your own decisions. So the next question goes to Dr. Hynes. How long does the coronavirus stay on surfaces, and how do you take groceries and mail into the home safely?
All right, thanks, Kerry. Basically, as we continue to learn about all this, everything varies, like she was saying. As best we can tell, you're looking at about 72 hours on any plastic surface, about 72 hours on a stainless steel surface, about 24 hours on cardboard, 4 hours on copper, which shows up on every chart, and I still can't figure out why, but copper is always there. And then paper, you see, enters all over the place. It could be minutes to as long as 5 days, which really leads to how often should you be regularly cleaning certain surfaces in your house. You really can't do it too much. The stuff that is touched constantly, you want to make sure to hit: toilet handles, faucets, sinks, countertops, tables, light switches, controls to the stove, doorknobs, handles, and then the things you don't think about: remote controls, your phone, your computer. All those things should be wiped down on a regular basis. And as long as they do, you're going to minimize transmission back and forth as best you can. As far as food goes, there's really no study that says it's spread through food. It's generally assumed there's a very low risk for any real transmission from groceries or packages. So really with groceries, you've got two main options. One option is leave it out for 24 hours, which is simply not practical, not to mention a little problematic with some of the meat you leave out for 24 hours. The other option would be to wipe down all your containers as soon as you get home. Wipe them down, then you put them away, then you wash your hands well. That should be more than enough. Several places have gone to bring up, don't use your reusable bags that you usually take to the grocery. Leave those at home. Use their cheap plastic bags. That way you're less likely to bring stuff home. You won't have to worry about contaminating your reusable bags. As far as mail and packages go, the assumption continues to be that the risk is incredibly low for that. So you just open up your mail, open up your package, wash your hands well, and that should take care of it.
Thank you. Since you're doing so well, let's give you another one. What is the best mask to wear, and how can I put a mask on my 2-year-old?
Like wrestling a bear is how you do a mask on a 2-year-old. It's generally assumed that anybody older than 2 years old should be wearing a mask per the CDC. Several cities continue to enact laws encouraging over 5 to wear a mask, over 2 to wear a mask. But the general assumption is anybody over 2 years old should be wearing a mask. There's 3 main types of masks. You can make your own mask. There are surgical masks you can get a hold of, or there's the N95 mask that everybody continues to hear about. The N95 masks are different. Those are special. Those really kind of prevent you from inhaling smaller airborne infectious particles, which is why they say those are primarily for healthcare personnel. Those are what are in short supply. Those are what everybody's trying to get their hands on. That prevents you from picking up things from somebody else. What you're doing with the make your own mask or a surgical mask is you're really trying to prevent the spread. So when you cough, you sneeze, you contain it in your mask, you don't spread the germ to somebody else. So any of those masks would be good for wearing out in public. Under 2 years old is a whole separate issue. The American Academy of Pediatrics recommends under 2 years old, you don't try to put your child in a mask for numerous reasons. They have smaller airways. It's a lot harder for somebody under 2 to breathe through a mask. There's a little higher risk of suffocation for a child under 2 wearing a mask. They wouldn't be able to take their mask off if they were having trouble breathing. And honestly, they're far less likely to keep the mask on. The biggest reason to wear a mask, especially when we're out in public, is to try to avoid touching our face, try to avoid touching our eyes, our nose, our mouth, because that's how you're going to let the virus or the bacteria into your body. So if you can minimize touching your face, you can minimize your risk for infection. So that leads to how do you protect the kids who are less than 2 years old? The biggest way is just limit their exposure to outside. Don't take them out unless you really have no other option. If you're a single mom, you have to go to the grocery, you've got no way around it. We've all already seen the memes of the mom who put the sign on the back of her kid in the grocery explaining she had nobody else to watch the kid, so nobody yelled at her. If you've got an infant, you just take the blanket, cover up the car seat. Don't cover up the infant, just cover up the car seat. And that way they're protected from everybody coughing and sneezing on them.
Thank you. One follow-up. If somebody in our audience has access to an N95, do you think that that's more beneficial to a regular person who's just walking around to wear an N95?
At this point, they recommend N95 still try to stay with healthcare personnel. It would certainly be, of the 3 choices, it would be the more effective mask, but then you're taking away from a healthcare personnel who may have trouble getting a hold of it. I would still recommend make your own mask or a surgical mask that you can maybe get a hold of off Amazon.
Okay. And then the other point is, if you don't wear it properly and you don't do a fit test and it doesn't really
Correct.
fit you snugly, it's no better than a regular mask. So it's probably a lot harder to deal with. So you're probably better off just in a regular mask. I'm seeing a lot of nodding, so that's good. This is for Dr. Levin. My husband tested positive. How do I care for him without getting the rest of us sick?
Yeah, that's a good question. I think that's a question that we're getting a lot of. And I think, the main answer is quarantine, right? So we all talk about quarantining when you test positive for this virus, and certainly anyone at home who tests positive, as much as you can within your living situation, you want them to be in their own space, in their own room, not sharing the same space or utensils or anything as anyone else. So ideally they'd be in their own room, in their own space with the door closed. You can bring them food, leave it by their door. Obviously, anytime you bring food to them or take food from them or bring them anything that they may need, you're gonna wanna either wear gloves or wash your hands or both. And I think, so quarantining and hand washing are probably the two keys in that situation.
Great, thanks. Dr. Strauss, my husband and I are first responders. I am terrified about bringing COVID home to them, even though I know kids are resilient. What should we do? So this is another risk benefit, huh?
Yeah, this is a real common question that we're getting these days, and it goes back to your assessment of what are the risks. And it's really scary because we don't really know the risks for this new virus the way we do for traveling in a car in your example that you gave before. So I can tell you a little bit about how we approach it in my life. Obviously, I work in a medical practice, and my wife does too. Our risk is fairly minimized because we're doing mostly telemedicine. But we have an adult son who lives with us who works in a coronavirus testing center. We take reasonable precautions. We come in, we wash our hands, we change our clothes, we shower, but then we try to go about and live our lives as best we can on a reasonable basis. I think the risk-benefit shifts if you have somebody in your home that is at higher risk, if you have an elderly relative, if you have somebody in your family or a child who's had an organ transplant, somebody who's had cystic fibrosis, for example, then you may want to approach this differently. You may want to sequester. We've had healthcare workers who've moved out of their homes. I'm curious how other members of this panel might handle that issue. Anybody else want to tackle that question?
I can give a personal situation that I have going on this week. I have both my parents are living. My father happens to be in the hospital this week. There are no visitors, so none of them have been there. None of us have been to see him, and he's looking at a pretty significant surgery this Thursday. And my mother has some health issues, and she's immunocompromised, so she's home, and I won't be going to visit her because I'm working and I bring risk to her that we feel could be undue risk. She's managing fine on her own with the help of neighbors, taking care of things, leaving them at the door for her, running errands. And in this case, I've advised her, in fact, the surgeon and I both spoke to her today, and even though they would make an exception and perhaps let her come to visit him after the surgery, we both advised her that it would not be a good idea and that we would wait and see how he's doing. And if he weren't doing well, then we might change that plan. Again, a risk-benefit decision. But if he does well, he's in good hands, he's got a great surgeon, it makes no sense for her to then end up with coronavirus. He does not have COVID. When you have surgery, you have to be tested.
And as I shared last week, we have a newborn in my house. My daughter gave birth at the end of March, so I chose to go strictly on telemedicine so that I could interact with the baby. Now, if I had to work, if there were a reason for it, I would, and I would come home and I would wash my hands a lot and not feed them, not make dinner for everybody, and I probably wouldn't be touching the baby right now. So we all have to kind of figure out where we fall on risk versus benefit. Kevin, you want to give us the takeaway slide? So we're going to end each session with a takeaway, and my computer just went out. Give me a second. Yeah, I'm totally not there. Susan, you want to read the takeaways?
Sure. I've got the tiles are covering a bit of it, but it's keep 6 feet away in public, wear masks in public, and I believe it says those are probably only for children over 2 years of age. Outdoor play is important and healthy from children. We want to try to do our best to keep our hands away from our face, and we only are recommending what are described here as mild precautions around food and meal. In other words, hand washing is certainly the most important thing.
Great, thank you. Our next session is going to be on mental health and parenting, and most of those questions are going to go to Dr. Freedman. So the first question is, my 4-year-old keeps talking about death, from flowers to people. How would you help her understand?
So first of all, it's very developmentally appropriate for that age to start show curiosity about death. You know, children at that age really just see death as something like temporary, it's reversible, it's impersonal. They don't really understand the finality to death until mid-elementary school. So when you're really talking with your child about death and how to explain it, really use simple, brief, concrete language. So keep things simple. So when flowers die, they don't bloom anymore, or when people die, they don't eat, they don't play, keeping it really simple. Be prepared that they may ask the same questions over and over again, because as we know, preschoolers like to repeat questions, so they may need that same information over and over to understand. And of course, just, keep open conversations with your child about it, reassurance that they're safe. I think that's a lot of the questions that kids ask at that age is, am I safe? Am I going to die? So really making sure that they understand that they're safe.
Great. Next question. Is it okay to let my children be on a later schedule than usual?
Yes, as long as you're consistent. Now, I do recommend when we have an idea of when things are going back to normal, to slowly ease back into the schedule you usually have and the one you want, so it's not this huge shock.
Great. Next is, can you speak to recommendations regarding younger kids not liking virtual learning and wanting to maintain relationships? How important is it to stay in school when school is not going to happen this year anyway?
Right, that's a really good question. So a lot of younger kids are really struggling with the e-learning is what we're seeing, because they're used to really hands-on play in school, and now you're having them sit at a screen. So of course their attention span is not going to be there, that engagement. I've heard from a lot of parents that my kid is just walking away, they're not really interested in it. That's okay. In terms of whether you want to pull your kid from school for this year, that's a very personal decision. That's up to each family. I would recommend continuing with it. Kids didn't really get like a goodbye to school, goodbye to teachers, goodbye to anything. So I think it's good just to really keep up with finishing the year with the rest of the class. Maybe they'll do something nice virtually all together. So really just continuing with that. With helping the younger kids, if possible, if it's live, this is a little harder, but divide it into small chunks rather than doing all of the learning at once. So a little bit, take a break, a little bit more, take a break.
Gotcha. And keeping them in school helps them keep a schedule, right? Which
Absolutely.
is really important. Okay. How can I help my 10-year-old when she feels extreme anxiety or a panic attack? Are there specific exercises that will help?
So again, very normal during this time. Remain calm yourself. Again, children model what they see, provide support. There's plenty of exercises, and I think we talked about last week, but I can say it again, different apps you can use, such as the Calm app, such as Headspace, that provide a lot of really good meditation, guided imagery. Deep breathing is important. But really what treats anxiety and panic attacks is something called cognitive behavioral therapy, or CBT. So I'd really recommend, reaching out to your pediatrician, getting some recommendations on getting some mental health treatment to really specifically treat the anxiety and the panic attacks.
Thank you. And last question. How do I talk to a 4-year-old about his tummy aches that might be stress, and ask questions to see if it is stress or actual sickness?
Right. So you want to explain like the gut-brain connection, and I'm just going to explain it in the very simple terms that you can use with your child. So basically, your brain up here and your stomach here, they're connected, they're on the same body, but they have a really special relationship with each other, more so than other parts of the body. So much so that when one feels something, so does the other. So if you think about butterflies in your stomach, so when someone has butterflies in their stomach, they may feel nervous up here and they may have some pain down here. So that's a good way to explain it. When one feels something, so does the other. So it doesn't mean that your child is faking or anything like that. It just means that gut-brain connection is working. So look for patterns. If you notice, hey, my kid is always complaining about stomach pains at nighttime or before an activity they don't like, that's probably more stress related rather than, a medical issue. Asking your kids, is there anything stressing them out? Maybe during COVID, what specifically is stressing them out, to get a little more idea, is this stress related again, or is this medical? And of course, always following up with your pediatrician if you have any questions about that, or you're having trouble really distinguishing between the two.
Great, thank you. Can we get the takeaways? Yep, it knocked me out again, but
you read it?
No, I'm smart. I got it on the other screen. I got prepared. So signs of depression, which I guess we must not have gotten to that question, but signs of depression: increased isolation and irritability in the older children, and in the younger children, or really any age, significant change in sleeping, eating, or mood. How do you deal with anxiety in your child? Remain calm, be a good listener, explain the connection between our brains and bodies. Teach breathing, mindfulness, imagery. Recognize the goal is not to eliminate anxiety, rather to manage it. Model ways for your child to manage anxiety. Avoid allowing the child to avoid fearful activities. That's an important point. The more we let children avoid something, the harder it gets for them to do it the next time. And always ask for help from a professional. Next.
One thing to back up to for just a second, the question about the later schedule than usual, just for the parents' mental health, for the older children, high school, especially the college kids that are all at home, just look at your college kids like they're working a third shift, and that's the way to kind of approach it. They're on a whole different schedule than we are. Don't try to make them go on your schedule. Treat them like they're working third shift at a factory, and things will go much smoother at home.
And then just in general, behavioral health questions. Remember that children are not little adults. They have lots of different stages, and you need to deal with your child based on the developmental stage. Your pediatrician or your mental health professional can help you figure that out. Children do best with a regular and consistent schedule. Validate the feelings they are having during the pandemic. None of us are particularly happy all the time right now. And that's okay, and it's okay for you to share how you're feeling with them too. Positive encouragement is always good. When you catch them doing something that you want, encourage that. And then just don't be afraid to check in with your trusted pediatric professional. Any of us on the panel, Dr. Freedman, we've all been to, even our allergists, I'm sure, are all dealing with a lot of mental health questions right now. And we're really happy to do so. We don't judge because we have families too.
And I think the opportunity we all have now to do telemedicine with our patients, and given that it's the COVID emergency, we see insurance coverage even in places where maybe we didn't have it before, like Illinois, and having a conversation with one of us about any of these issues is really an excellent way, because I find it's much better as a face-to-face conversation. And sometimes we even get an opportunity as we're talking to you to sort of see it in action firsthand right at home, which can be helpful as well. So don't hesitate to think about a visit that way with us, which seems to be working very well for some families right now.
Thank you, Dr. Sirota. Our next section is going to be on the COVID illness itself. And we'll keep going with you, Susan. Do children get sick with COVID at the same rate as adults?
So they don't, and this is an area where I think this is really good news for children in particular, but especially for their parents, and hopefully to reduce some of the worry that we all have for children. So when I say that, children really are the least vulnerable when it comes to coronavirus. So just to give some numbers, because I know sometimes the parents of my patients like to hear this, if we look at confirmed COVID-19 cases, so people who have been confirmed to have COVID-19, and we look at those that are under 18 years of age. So our population is pediatricians. In the United States, those are only 2% of the cases. In China, about 2%. And then if we look at a couple other European countries like Italy and Spain, it's just about 1%, 1.2 in Italy, and just under that 0.8%. So children really don't seem to be acquiring this illness. And then let me give you just a little more information in general to testing. When children are tested or have been tested, and again, this is a new virus, it's about 4 months old, so there's still a lot for us to learn, but when children have been tested in other countries, in addition to our own, and these are children who have symptoms that could be possible COVID-19 symptoms, only about 6 to 10% of those children tested will actually have this particular coronavirus. They're going to have something else in most of those cases. Interestingly, in Iceland, they studied almost 1,000 children who had no symptoms. And I'm sure everyone's heard about all the adults who have no symptoms and end up testing positive. Well, when they looked at almost 1,000 children without symptoms in Iceland who are under 10 years of age, none of them tested positive. None were positive. And then when we look at other countries besides that, where they've tried to test children who had no symptoms, what they found is it could be anywhere from as low as 4% to about 13% of those kids without symptoms could still test positive. So again, kids around other kids are probably not very likely to give this to one another. And then just to bring some of that information home to our geography, one of our children's hospitals here, Lurie Children's Hospital in Chicago, they recently started testing all children who were in the hospital, and they were trying to establish, again, one of these baselines. And this information is as recent as last week, but by last week they had tested almost 500 children. They were just testing all children that came to the hospital, and of all those tested, those 500, only 8% were positive. So I think the take home here is that if your child is sick, don't be afraid to contact us. Don't be afraid to come in if we tell you on telemedicine that we actually do need to see them to figure out what's going on. Because as you can see from these numbers, it's very likely if your child is sick that they have something else, that they don't have COVID-19. And I think that's important to know as parents.
Great, thank you. So when a kid actually does get sick, Dr. Hynes, what are the signs of COVID in a child?
The signs are similar to adults. They're going to be a lot milder. They're generally something that can be managed at home unless you've got a chronic illness that puts the child at a much higher risk. Most of the studies will say about 73% of kids will have fever or cough. As Dr. Sirota was saying, there's certainly a large percentage that don't show any symptoms at all. Chinese studies said as much as 16% for some of the kids. Other kids may have fatigue, a little bit of congestion. Certainly some stomach issues have been noted to be part of this as well, some vomiting, some diarrhea. As recently as today, a study came out discussing rashes associated with this, purple feet, purple lesions on their feet that tend to be more painful. They're not sure what to make of that, but there have been enough children throughout the world that have shown that they're starting to question whether that's one of the earliest symptoms. Regardless, you're only looking less than 15 to 20% of the kids would even be hospitalized if they had it. Those are generally the kids that have a higher risk factor. Of those, only less than 1 to 2% are going to end up needing the intensive care unit care like the adults would. So if your child's having symptoms that are much more serious, trouble breathing, trouble feeding, you would obviously call your doctor first. They'll talk through everything and figure out maybe we could just see you through telemedicine. If it's severe enough, we can see you in the office. Your pediatrician's always your first option. They're always going to make sure you get the right care in the right place at the right time.
Great, thank you. And Dr. Sirota, if my child does need to be hospitalized, will I be able to go in there with them?
Absolutely. And, you know, I had this question asked of me, and it makes sense that parents are wondering this because we're all, I just mentioned it myself, we're all hearing about adults in the hospital who are not permitted to have visitors. But, you know, first of all, we just heard it's very unlikely that a child with COVID-19 would end up hospitalized. But if that situation were to rise, a child would absolutely not be separated from his or her parent. So unlike adults who aren't permitted, children are permitted to have a parent or to have a single visitor stay with them, obviously a healthy individual when they're in the hospital. And, you know, and I will also mention the same goes for a child who gets admitted to the hospital or ends up in the hospital at this time, because children still get other things like appendicitis where they need surgery. Those children also are permitted to have a parent with them.
Great, thank you. So my daughter just, you know, gave birth, and the big question was whether her husband could come, and she didn't have any visitors, and, you know, now we have the newborn. So how concerned do we need to be about a newborn getting exposed to COVID? And what would be the symptoms? Dr. Sirota? Yeah, so, I mean, the symptoms would really be among the symptoms that Dr. Hynes talked about, but it appears that only about 10% of newborns will have this early onset infection. And if it's early on, it seems to be mostly respiratory and a pneumonia. But although newborns might have a higher risk of being hospitalized, like any other condition in a newborn infant, children under a year of age only represent about 0.3% of the hospitalizations, all the hospitalizations in the US. It also doesn't appear that infected mothers can pass COVID-19 on to their infants. So they can't pass this through the pregnancy, although an infant could acquire it from person to person spread from a mother who's positive. And as you know from, you know, your family's experience, most mothers who are going into hospitals now in labor are getting tested for COVID. So they do know if they test positive or not. They do rapid tests, so they know at the time of delivery of the infant. And then the hospitals, and each hospital has a little bit different way of managing this, but then the hospitals have their own plan and rules for isolation, for visitors, for mother and baby, and so on. But if a newborn does end up with COVID-19, we do expect that they will have a mild course of illness and recover in about a week, is what it looks like. It takes about a week. So. Great. Thank you. So we have a lot of talk about symptoms and the fact that kids don't get that sick, but, you know, in general, what are the treatments? So this question is, if Tamiflu works against viruses, why won't it work against COVID? And also, what about Zithromax and hydroxychloroquine and other treatments I hear about in the news? Dr. Strauss.
Well, there are no treatments that have been shown to be effective for coronavirus at this time. There are many that are being studied. There are trials going on all over the world and many in our area. But Tamiflu is just one drug that works against viruses. It works against influenza virus. It does not work against coronavirus. So just like we have different antibiotics and different antiviral drugs, it really has to be targeted to fit the right organism. So good question, but that's not one drug that's being studied in this case.
So should I ask my doctor for a Zithromax prescription just in case?
No, that's any drug that you know, is being purported to work should go into a clinical study. As I said, there are no drugs that have been shown to be effective to work. And as you pointed out, all drugs have side effects, have risks. So you don't want to be taking a drug that's going to make you feel worse when there's no evidence that it works.
Great. Thank you. Can we get the summary slide for this? So the summary for infants and children, it's all good news. They get less disease overall, mild or no symptoms. If they get sick, it's less serious illness. Most children can be treated at home with supportive care. There are no known medications for COVID disease, but you should keep in touch with your pediatrician so you can diagnose through telemedicine whether we think it's COVID or perhaps an illness that we can treat. The next set of questions is going to be on asthma and allergy. And I'm going to start with Dr. Kreiner. How does COVID affect kids with asthma?
All right, so we did come across many different questions about the risk and safety regarding asthma in regards to COVID-19. And I want to briefly touch on control and safety of the medications. The most important thing we can do right now is make sure your child and your own asthma is under control, because well-controlled asthma is not, does not increase you or your child's risk of a bad outcome. It's important to take all your necessary controller medications as prescribed, including your inhaled steroids, nasal steroids, which help treat asthma and allergies. And taking these medications does not make you more likely to get COVID-19. It doesn't put you at increased risk, and it does not decrease your immune system, which some people have asked. There's also nothing that shows that if you double up on the medication that you can boost your immune system. If you take your routine medications as prescribed, you practice good hygiene, you eat healthy, that's the best you can do right now. But if you feel that your asthma and allergies are not controlled, it's a good time to touch base with your pediatrician, your pulmonologist, your allergist, just to help adjust your medications if you feel like you might not be controlled. And also another point that some people had questions about was oral steroids, which have been a little bit controversial. So if you do think you might require oral steroids, it's a good time just to touch base with your provider.
Great. Next question. My child uses a nebulizer when he gets a cold. Is it safe to use the nebulizer if I suspect my child has COVID-19?
So that's also a good question. Know some back and forth, different providers will tell you different things. At this time, we are recommending to use inhalers with an aero chamber or spacer, which is actually the best mechanism to get the medication properly. But if you only have a nebulizer at home and your breathing is not controlled and you have a cold, the most important part is to use the medication that you have to control your breathing and control your symptoms. If you want, you can designate a room that you use your nebulizer in so that you're not dispersing the respiratory droplets, but chances are you have COVID-19, you've already exposed other family members at home.
Right. And ultimately, breathing is really important.
Exactly, breathing is important.
Next question. For children who suffer from seasonal allergies, is it safe to begin Zyrtec? Are there any concerns with the effects of over-the-counter medications with this virus?
Me again, yes. So yes, it's okay to start your antihistamines, your Zyrtec, your Allegra, your non-sedating antihistamines. Again, there's no increased risk or concerns to take your antihistamines or your intranasal steroids. In fact, we highly recommend that you start these medications, especially now that we're in allergy season. We do want to prevent that sneezing and coughing and make sure your allergies are very well controlled so we don't spread those respiratory droplets everywhere to those around us.
Great. Now here's a non-COVID question, but it's important because it reminds us that life goes on a little bit. I live in New York City. Should I introduce peanut butter and dairy to my 7-month-old? I have not done so yet due to fear of him having a reaction and needing to go to an emergency room.
So this is a great question. A lot of things have been tweaked because we're in this pandemic about how we would routinely manage different things, but we still recommend continued early introduction of foods to prevent food allergies in young kids. If you have mild eczema, based on the LEAP study, we do recommend early introduction of peanut. If you have moderate to severe eczema, you might want to touch base with your allergist to kind of discuss a plan going forward. That's a great time for telemedicine from the comfort of your own home. If you also have significant wheezing episodes, you might not want to introduce a concerning food and also a touch base with your allergist. But if you do introduce at home, have an antihistamine on board, or I'm not on board, I'm sorry, have an antihistamine on hand so that if there is, some hives or a little bit of a reaction, you have some medication to treat.
Great. Before we do the takeaways for that, since every time you switch to a slide, I glitch, I'm going to go to the immunity questions and then we'll do them both together. So Dr. Strauss, what vitamins or supplements should we use to help prevent COVID infection? There's so much out there and it's very confusing.
The short answer, none. We have an incredibly robust immune system that protects us from bacteria and viruses, a whole world of microorganisms that attack us on a daily basis. But we have all these great white blood cells, we have millions of antibodies, we have lymphoid tissue, which does a good job of surveillance and preventing us from getting sick in most cases. Now, vitamins are part of our immune function and response, But vitamin deficiency in the United States, that's exceedingly rare. So taking extra vitamins is not going to boost or supplement your immune system. Look, I get it. You want to do something to see if you can prevent yourself from getting sick. And I know plenty of doctors and nurses that take vitamins and supplements, but there's no data to show it's effective, and I don't recommend it.
Okay, thank you. So what can we do to boost our immune system?
Well, I'm going to give you the simple lowdown. For your immune system to function well, you need to be working in tip-top condition. So you want to get your vitamins and minerals by a really good resource. You want to have a diet with plenty of fresh fruits and vegetables. You want to eat a really healthy diet. You want to make sure you and your child are getting an adequate amount of sleep. There have been studies that have been demonstrated that immune function is harmed by poor sleeping habits and just not getting enough rest. You also want to make sure your weight is in a good, healthy range and that you're getting plenty of exercise. Any athlete knows that when you're priming for a fight or an athletic event, you want to be in tip-top condition. So whether you are planning surgery or cancer recovery or you're going to get sick, you want to be as healthy as you can be. And finally, the most important thing you can do to boost your immune system is get your immunizations on time. Immunizations are the greatest advance we've had, with the exception of clean drinking water, for improving public health. Little fact of history. One of the reasons we may have won the American Revolutionary War was because of George Washington's decision to inoculate our troops. He knew even back then that many more people were lost due to infection than they were from bullets or in battle. So that's one of the reasons we won the war. And the fear that we're experiencing now with the coronavirus is the same kind of fear that previous generations had for diseases like smallpox, polio, measles, and yes, even the flu, which killed many in 1918. So bottom line is, a lot of us physicians are very concerned that people are going to be afraid to go to the doctor with their young kids and get the immunizations that they need. And we may see a resurgence in some of these diseases like measles if we do not do that.
Well, certainly on a pediatric panel, talking about vaccines is always going to go over well. Thank you for that, Dr. Strauss. I'm going to go over the allergy take-homes and then the immunity take-homes. So number one, and this question gets asked time and time again, controlled asthma does not increase your risk of COVID complications. So take your asthma medications as prescribed, including your inhaled steroids, which are probably the most important thing to keep you in control. And then for your allergies, your intranasal steroids and whatever other medications you need. Check with your doctor before starting oral steroids like prednisone. Take your over-the-counter allergy medicines as needed, preferably daily during allergy season. Use inhalers with spacers instead of nebulizers when possible, but use your nebulizer if needed. Breathing is number one concern. Continue with the early introduction of solid foods to babies to prevent future allergies. Next slide. And as far as improving immunity, there is no proven benefit to supplements, despite the billions of dollars that Americans spend every year on them. The most important thing is a healthy diet, regular exercise, so do take your child outside, and adequate sleep. And then most importantly, vaccinate on time for all vaccine preventable diseases. Next. So our next question, the vaccine, is a perfect lead into well visits. So all of us on this panel have gotten a lot of conversation from our patients about coming in for well visits. So here's a question for Dr. Sirota. I am worried about bringing my children who need vaccines to the office for their checkups. At what age and for how long is it safe to delay my child's vaccines?
So I want to sort of do this in two parts, if that's okay. I want to talk about the things that most pediatricians are doing so that we can make our offices as safe as possible for you to come in. But I also want to talk about delaying vaccines, and I think I'll start with that first. It's never safe to delay a vaccine in a healthy child, not for any shot and not for any disease or for any reason. And as was already alluded to by Dr. Strauss, during a pandemic, the last thing that we want to see is an outbreak of some serious vaccine preventable disease like measles. And for those of you in New York, you already know what it was like to deal with a lot of measles cases not so far in the past. And we certainly don't want to see that again in our country or really anywhere. But this could truly happen because many of these diseases that are vaccine preventable could have a resurgence if people delay taking their children in or altogether skip vaccines. And in fact, the diseases that are prevented by vaccines are generally far more serious in children than what we've just described to you that we're seeing in children from COVID-19. I think it's also important to understand when we ask about delaying, and I think Dr. Fierstein, I think you made this point last week really well, but I'll repeat it for people who weren't there, is that the early vaccines we give, particularly in the first 18 months to 2 years of life, they are not boosters. These are part of what we call the primary series for vaccines. And what that means is it takes all of those shots at the time that they're supposed to be given in the way that they're supposed to be given to provide the protection that we want children to have for these really serious diseases. So we give vaccines a lot. We give them at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months. And then throughout all of childhood, we give boosters for all of those things, and we give vaccines sometimes for the first time for prevention of cancers like HPV, or for very serious meningitis that we can see in teens and young adults. So there is really no time where it would be a good idea to delay and or skip vaccinating altogether. And I hope we drive that point home. So how can you feel safe then coming into our office now that I've given you the idea that it's not a good idea to delay vaccines? So let me tell you about what practices are doing. Doctors are separating when or where they see sick and well patients. So they create times in the day that are exclusively for well visits. The office has been cleaned in a way where no sick children have been there, usually for many hours, including overnight. We ask only one healthy adult to come with each child rather than all the siblings and sometimes all the parents. We screen parents and patients ahead of time if they're coming for a checkup visit to make sure they've not developed symptoms. We do things like check temperatures on patients when they're coming into the office. Many patients are wearing masks. Our staff are all wearing masks. We take temperatures on our staff, everyone working in our office every day. And then we do as much as we can that we would normally do when you come into the office, like stopping at our registration desk or spending time in the room talking and answering questions with our nurses ahead of time. We're not doing that anymore. So that's happening prior to your appointment, maybe before on the phone or maybe from the parking lot before you come into our offices. And we maintain social distance. We don't use our waiting rooms. We bring patients in a staggered way, so they go straight into a room, they're met at the door. And I think we're a little bit like the grocery stores these days too. You're coming in one door and kind of one-way traffic out the other way, so that when you're in our offices, it doesn't feel like it usually does. It really feels like you're the only one there. So these are the things we're doing. We've really shifted so that we can make it safe and do our part to help you keep your kids healthy and in a safe and comfortable way.
Thank you. I agree wholeheartedly that well visits and vaccines are important. But the next question is, I want to keep my well appointment, but I'm afraid, can we do our well visit remotely? And I'll answer that one. Up until last week, the idea of a telemed well visit didn't exist. But the American Academy of Pediatrics came out in favor of telemed well visits when there's no other way around it. So I think we can all agree we'd rather see you in person. We want to touch and feel, we want to use our stethoscope, we want to see you, we want to be able to draw blood and do a hearing test and do all those other things. But sometimes that's not possible, either because of your health and you can't bring your child in because of risk factors like we talked about, that risk benefit, or maybe you just can't get over the fear. And then there are visits where there are no vaccines needed. So is it still important to get those visits? And I would suggest that the answer is yes. Because look at the situation. Can you say, well, can I have my 6-year-old well visit in a month? The child's healthy. There's really no concerns about that. And yet, in a month, you probably could do it. But what's really going to have changed in a month? In a month, we're not going to have a vaccine. In a month, we'll probably have released some of the rules, maybe. If it's not in a month, then it's in 2 months. And then you're going to have more people walking through the office. The dentist in my building, who's now closed, is going to be open. So is that really better to wait in a month? Plus, what's the chance that you're going to get to see the doctor that you love for that double checkup for both of your kids that you planned on a Saturday in a month or two when maybe you're back to work? And when everybody in the practice who's thinking the exact same way you are is trying to schedule those same appointments. So if you keep your telemed well visit, you can do all the parts of the checkup that are by talking. And that really is the longest part of the well visit. Now that may be enough for a younger child, a 5-month checkup, maybe even a 21-month checkup where there's nothing going on and vaccines aren't needed. For anybody that only gets a yearly checkup, they are going to need a secondary supplemental exam where the doctor does listen to your heart and feel your belly, where we do our yearly screenings. Because we can't, in good conscience, sign a form saying that you're safe to go to school and camp and play soccer when all those things resume if we haven't seen you in person and actually listened to you. But that's going to be a much shorter visit. And right now, the thought is that that second visit, based on what they're advising us, there will be no copay for that. So your first visit is a well visit, whatever your normal payment structure is for that. For most insurance companies, there's no copay. And then the second visit would just be a supplemental visit, unless, of course, at that point you had another issue that you wanted to bring up. And then how lucky of you that you have your doctor right in front of you in a pre-scheduled appointment. So in-person exams are best. Vaccines must be kept, but well visits are an option by telemed. And I think those are my take-homes, which is the next slide. And of course, it's gonna knock me out again. Excellent. So here's our next question. This is a section that we're going to talk about called moving forward. How do we get to the next steps? Because a lot of people ask these questions. When will this be over? When can my kids go back to school? Will there be camp this summer? And of course, we don't know the answers to all that, but this is how we're going to get there. So how do we know, and this is for Dr. Hynes, how do we know when to start pulling back on social distancing with immediate family members, grandparents, etc.?
We're going to be having a follow-up email that should go out to everybody on the webinar that'll have a lot of information about social distancing, self-quarantine, self-isolation. Each one of these are different. Social distancing, we're trying to protect each other. We're trying to stay 6 feet away to minimize the spread of the actual virus. Self-quarantine, you've been exposed, you're trying to keep yourself isolated, you're monitoring for symptoms. Self-isolation, you've got it, and you're doing everything you can to prevent it from going to somebody else. The goal of these are really all the same. We're trying to protect everybody from the virus. We have several mathematical models trying to predict or guess what the virus's behavior is going to be, and none of us really know. This is a novel virus. We've never seen this before. We don't know how it's going to behave. Everybody's assumption that we're just going to have one wave of this and it's going to peak and it's going to go away is probably not the way this is going to be. We're probably going to be going through waves of illness. We'll go through waves where we'll have more social distancing, more periods of time where we have to kind of repeat this, potentially in the fall. So the answer really depends on, one, where you are and how well your area is social distanced and how well the areas around you social distanced. This is going to be the new normal until we have a vaccine that's available. So there's no direct answer to how long we're going to social distance for our relatives. If your area has done a great job, if you peak pretty quickly, things settle down, and then we can start to open things back up, and it would be safe for you to be around your relatives. All this has to do with the safety of those that are higher risk. They can't protect themselves, so we're taking one for the team and doing it for So until the vaccine's available, this is kind of the new norm. Government, several private labs are working extremely hard on the vaccine, and I believe Dr. Fierstein is going to talk about that in another question or two.
Yeah, I would say that at this point, if you've really been social distancing for 2 weeks and grandparents have been social distancing for 2 weeks, this gets back to the isolation and the risk benefit. There's no reason that you guys can't see each other, especially outdoors, and maintaining social distance. And then you get to have that kind of interaction. But, you know, clearly this is not all going away anytime soon. But whenever we hear...
Several grandparents have gotten very, very, very good with FaceTime.
Yeah.
And that's been a godsend. That's all good.
We hear all of the elected officials talk about testing. We need to do more testing. What does testing really mean in the pediatric population? How do we use it? And this is a question that we've gotten a few times. My child was really sick in early March, and I think it may have been corona. Can I get her tested? Dr. Levin, can you give us some information on that?
Yeah, so everybody wants to talk about testing, and we all are talking about testing, and everyone on TV is talking about testing, and the government is talking about testing. And the truth is that it's a new virus, and we're still kind of working out the kinks. So we don't have hard and fast definitive answers like we'd like to have right now. But let's break down the basics on this. So there's two general categories of tests that we do. One is for kids who we think are sick. And for those kids, we will typically do a nasal swab or a nasopharyngeal swab where we take a Q-tip, put it into the nose, and then run a test on that mucus sample and look for the actual virus. We call this usually a PCR test. And so this is something that is being done at most hospitals and ERs and some drive-through clinics. And that's the test to see, do you actually have the virus? The second type of testing, and the one that is getting sort of mixed comments out there depending on who you listen to, is a blood test that looks for antibodies. We call it serology testing. Two types of antibodies, IgM and IgG. IgG is the one that we think shows that you have had an infection in the past. So when people are asking questions like, I think a month ago my child may have had COVID, how can I get them tested? The theoretical answer is we would draw their blood and test them to see if they have IgG antibodies to the COVID virus. Now the problem is we're still trying to figure out exactly which is the best antibody to measure to test that. We're still learning which antibody does the body produce the most of when you have an infection, and how long does it stay at a high number for that we can measure it. So there are many different labs working on these tests. There are many different versions of these tests out there. Some are better than others. And I think over the next few weeks to months, as we learn better which tests work the best, which are the most accurate, which can give us the best information, then we'll be better able to answer the question for the parent of, hey, did my child have this in the past, when we are able to do those blood tests. So again, in short, two types of corona testing. One, a nose swab to see if you have it in the moment. Two, a blood test to see if you've had it in the past. And we're currently working to nail down both of those tests to make them as accurate as possible.
Excellent, thank you. Next slide. So this is actually one of my patient families, so I'm going to take this question. And as you can see, it says, when a COVID vaccine is made, how is it determined if it is a one-time thing or an annual need like the flu shot? And then his brothers add that I am a big chicken like my mom, and me too. So everybody's talking about a vaccine. We've talked about a vaccine tonight. Making a vaccine is not an easy thing. We have to make sure that it's not only effective, but very, very safe. So there are lots of trials, and making a vaccine usually takes many, many years. Because there are so many resources being put behind creating a COVID vaccine, it's very possible that we'll have one between 12 and 18 months. But that's still a long time away when you think about, getting back to normalcy. So I think we're going to have to start to loosen restrictions even before then, but we certainly won't go back to normal. Now, how will we know how many shots the vaccine is? Like Dr. Sirota said, some of the vaccines are a series of shots. It's hard to know. We won't really know that until we start testing it. The flu vaccine is 2 shots for kids who get it the first time when they're younger. And the H1N1 vaccine, which people may remember back from 2006, also became 2 shots for anybody that was younger. But this vaccine, it's hard to know, are we even going to give it to the children? Because the children are the ones that are being least affected. So while we want to protect them so that we can protect the rest of the community, it's going to, again, be a risk benefit. And we need to make sure that it's very safe before we give it to the children. What is a safe vaccine is the flu vaccine. And flu is much more serious for children than COVID. Flu kills children every year. And there will be a flu vaccine in usually August or September to protect for the next season. If you haven't gotten your flu vaccine yet, you can still get it this year if there are any available. But anybody who now is thinking, oh my God, I can't wait for a COVID vaccine, you really should be making sure that you get your flu vaccine as well. So let's do some take homes on this. So how do we move forward? There are lots of unknowns. We don't know the answers to enough questions to really give you that answer. It will vary by location. Different parts of the country have been affected in different ways. There are some states that are already talking about loosening restrictions, but a lot of it's going to have to do with testing, and testing has its limitations. A lot of you have had a flu test. That flu test, even when it's positive, sometimes it's a false positive or a false negative. That's one thing when it's the flu and everybody is not so worried and we don't have to worry about certain things with it. With the coronavirus, that's very different. The vaccine is over a year away, so that while it will be great to have, is not what we're waiting for with bated breath at this moment. And the question, by the way, of if we need to get the vaccine every year, that's also going to depend on what coronavirus does. Is it going to come back every year? I don't know. Nobody really knows. If it comes back every year, then you may need to get the vaccine more often. For now, all of us, we are planning about 2 weeks ahead in our practices. We're not really going further than that because we don't know what the restrictions are. We don't know how the best way to keep you guys safe are, but whatever that is, that's what we're going to do. So, Kevin, are there any? I know we've hit an hour. We actually timed this pretty well. I'm very impressed.
Yeah, we're getting good at this. Actually,
are there any questions?
There were some questions, but a lot of them were covered, and a lot of them were actually answered by Dr. Sirota during the seminar. So I think we're good. We did cover a lot of the questions with just our follow-up from the questions last week. I just want to thank you all again for joining us this evening, taking the time out of your busy day to help answer some of these unknown questions that a lot of the parents are facing today. So I'm thankful as a father to hear these answers, and I know the response from all our patients' parents has been overwhelming. So thank you very much. I appreciate it. We'll get this link out to everybody who's signed up, and we'll get more information out as well.
Great. Thank you to my panelists. Thank you to Adjuvant, and thank you to everybody who sent in questions.
Thank you. And we look forward to seeing all of you in our offices.
We're here for you.